Medicare Part B covers your outpatient medical care. Because there's a cost associated with Medicare Part B, the government doesn't require you to enroll in the plan. However, we want you to know that there can be consequences if you don't enroll in Part B when you first become eligible. Unless you have health insurance through your employer or your spouse's employer, you won't be covered for Medicare Part B services like doctor visits, lab work, and x-rays. If you change your mind about Medicare Part B, you can only enroll from January 1st through March 31st each year. If you sign up during that period, your coverage will begin on the first day of the month after you enroll. That means that if you change your mind in April and decide to enroll in Part B, you'll have to wait until the following January to start the enrollment process, and your coverage won't begin until the month after you enroll. That's almost a year without coverage, and a lot can happen in a year. Unless you had qualifying insurance coverage during the time you are not enrolled in Part B, you will face a 10% annual premium penalty for each year that you did not enroll in Part B. Of course, there are some exceptions. For example, you can delay signing up for Medicare Part B coverage without a penalty if you're working beyond the age of 65 and are covered under an employer plan, or if you're covered under your spouse's employer plan. You have up to 8 months after you come off the plan or retire, whichever comes first, to enroll in Medicare Part B, even if this date falls outside of the annual enrollment period. Now that you know the basics of Original Medicare, let's talk about how you can sign up.